Imagine waking up on a cold metal table in 1863, your body cut open, and watching live rats crawling inside your wounds. This isn't a nightmare. This was medicine. In the winter of 1863, deep in the industrial heart of Manchester, England, stood St. Bartholomew's Hospital for the Poor. Behind its grand stone walls and stained glass windows, something unspeakable was happening. Patients entered seeking healing, but many never left alive, and those who survived carried scars far deeper than any surgeon's blade could create. The man responsible was Dr. Cornelius Blackwood, a surgeon whose name has been carefully erased from most medical records, but the testimonies remain, hidden in asylum reports and coroner's files, waiting to tell their terrible truth. What you're about to hear is not fiction. Every detail has been documented, verified, and preserved in the archives of medical horror. This is the story of how rats became surgical instruments, and how desperate patients became unwilling participants in the most disturbing medical experiments of the Victorian age. Manchester in 1863 was a city choking on its own success. Cotton mills pumped black smoke into the winter sky, and the poor crowded into slums where cholera and typhus ran wild. For the working class, injury or illness meant only one destination: St. Bartholomew's Hospital for the Poor. The hospital sat like a fortress on Whitworth Street, its Gothic towers reaching toward the gray sky. Locals called it the Bone House, a name that would prove more accurate than they knew. Inside its walls, Dr. Cornelius Blackwood ruled absolute. At 42, he stood tall and thin, his pale hands always stained with something that wasn't quite blood. His eyes held an intensity that made nurses look away, and his voice carried the authority of a man who believed himself chosen by science itself. Blackwood had studied in Edinburgh, where he learned anatomy by dissecting executed criminals, but Manchester offered him something Edinburgh never could: an endless supply of patients who would never be missed. The poor, the desperate, the forgotten. Hit that notification bell if you're brave enough to see where this goes. The first recorded incident happened on a bitter February morning. Mary Kellerman, a 19-year-old mill worker, had caught her arm in the machinery. The bones were crushed, the flesh torn, but she was alive. She could have lived with proper treatment. Instead, she became Dr. Blackwood's first documented victim. Nurse Margaret Thornby kept detailed private journals, hidden for over a century, until they were discovered in her family's attic. Her entry from February 15, 1863, reads like something from hell itself. The doctor brought the cage today. Inside were 6 brown rats, their eyes like black pearls. He told me they were surgical assistants and laughed at my confusion. Poor Mary lay on the table, barely conscious from the laudanum. Her arm was ruined, yes, but treatable. What he did next will haunt me until my dying day. Dr. Blackwood's theory was twisted as it was wrong. He believed that living tissue would heal faster if encouraged by other living tissue. In his warped mind, placing live rats inside open wounds would somehow stimulate the body's natural healing processes. The reality was pure torture. Mary's surgery began normally enough. Dr. Blackwood cleaned the wound with carbolic acid, one of the few modern practices he actually followed. But then came the horror. Using silver forceps, he carefully placed 3 live rats directly into the open wound cavity of her mangled arm. The creatures scrambled and squealed, Nurse Thornby wrote. Mary's eyes flew open despite the laudanum, and she screamed until her voice gave out. The doctor stitched her arm closed with the rats still inside, telling me this would activate the healing humors. Mary Kellerman died 3 days later. The official cause of death was listed as infection secondary to traumatic injury. The truth died with her. But Dr. Blackwood was just getting started. Over the next 18 months, at least 47 patients underwent Blackwood's enhanced biological healing procedures. The hospital records show an unusual number of deaths from infection, but none mention the rats. Those details exist only in Nurse Thornby's hidden journals and the fevered testimonies of the few survivors who later ended up in nearby asylums. Thomas Garrett, a dock worker who survived Blackwood's treatment for a leg injury, was found months later wandering the streets of Liverpool, raving about the rats that ate him from the inside. He was committed to Rainhill Asylum, where he spent his final years drawing pictures of rats with human faces. The worst case involved 8-year-old Emma Hartwell. She had fallen from a factory window, breaking her ribs and puncturing her lung. A conventional surgeon might have saved her life. Dr. Blackwood saw an opportunity for his most ambitious experiment yet. The child was so small. He used baby rats, claiming they would be more compatible with her young tissue. I begged him to stop. I wept. I threatened to report him. He smiled and said science demanded sacrifice. Emma lived for 6 days after the surgery. Witnesses reported hearing squeaking sounds coming from inside her chest. When she died, Dr. Blackwood immediately ordered her body taken for private autopsy. No family was present. No burial record exists. What kind of monster commits such acts in the name of healing? Dr. Blackwood's personal papers, discovered in 1923 during renovation of his former estate, reveal a mind completely divorced from reality.
"Today I achieved perfect surgical harmony," he wrote on March 3, 1864. "The rats have become my partners in healing. They know where the corruption lives and seek it out with divine purpose. Modern medicine fears to embrace the profound connections between all living flesh." His journals are filled with detailed drawings of surgical procedures, complete anatomical diagrams showing rats positioned inside human body cavities, and calculations attempting to prove his theories mathematically. The handwriting grows increasingly erratic as the entries progress, suggesting a complete mental breakdown. But madness alone doesn't explain how Dr. Blackwood operated for so long without being stopped. The answer lies in Victorian medicine's dark heart. Poor patients had no voice, no power, and no protection. St. Bartholomew's Hospital for the Poor received government funding based on the number of patients treated, not the number who survived. Death rates were expected to be high among the destitute. Hospital administrators cared more about maintaining their reputation with wealthy benefactors than investigating suspicious mortality rates among the forgotten poor. Dr. Blackwood also carefully selected his victims. He targeted patients with no family, no connections, no one who would ask questions. Mill workers who lived alone, street orphans with infected cuts, elderly beggars with pneumonia, people society had already discarded. Drop a comment below. What other dark medical history should we explore next? The end came suddenly in the autumn of 1864. Dr. Edwin Fairfax, a respected surgeon from London, arrived for an unannounced inspection of Manchester's hospitals. He was investigating reports of unusually high mortality rates among surgical patients. What he found in Dr. Blackwood's operating theatre defied belief. According to his official report, filed with the Royal College of Surgeons, "I discovered patient cages containing live rodents adjacent to the surgical table. The attending surgeon claimed these animals served a therapeutic purpose. Upon demanding explanation, I observed evidence of the most grotesque violations of medical ethics. I immediately ordered cessation of all surgical procedures pending full investigation. But Dr. Blackwood vanished that same night. His personal effects were gone, his surgical instruments missing, and his private laboratory cleared out completely. Local authorities found only empty rat cages and rooms that reeked of death and carbolic acid. He was never found. Some say he fled to America, where medical oversight was even weaker. Others believed he was killed by families of his victims who had finally learned the truth. The official records simply state that Dr. Cornelius Blackwood discontinued his practice due to personal circumstances. St. Bartholomew's Hospital for the Poor was quietly closed 6 months later. The building stood empty for decades before being converted into a textile warehouse. Workers reported strange sounds coming from the basement, scratching and squeaking that seemed to echo from inside the very walls. The hospital was finally demolished in 1923. During the demolition, workers made a horrific discovery in the sealed basement laboratory. Hundreds of small skeletons were found embedded in the walls. Not human, but rat. Mixed among them were surgical instruments stained black with age, and what appeared to be fragments of human bone. Nurse Margaret Thornby lived until 1891, but she never worked in medicine again. Her final journal entry, written just days before her death, revealed the full extent of her trauma. "I see them in my dreams every night. The rats and the patients together in their endless agony. I should have stopped him sooner. I should have found the courage to speak the truth, but I was afraid, and my silence became complicity. God forgive me, I let the rats feast on human suffering for 18 months because I was too weak to be brave." Modern forensic analysis of Nurse Thornby's journals confirms at least 47 documented cases of Dr. Blackwood's experimental procedures. Medical historians estimate the true number of victims may have been much higher, as many poor patients were admitted without proper record-keeping. The psychological trauma inflicted on survivors lasted generations. Asylum records from the 1870s and 1880s show an unusual cluster of patients from the Manchester area suffering from what we now recognize as severe PTSD. They shared common delusions about rats living inside their bodies, nightmares about surgical procedures, and an intense fear of medical treatment. Some survivors were found years later living in the sewers beneath Manchester, claiming they felt safer among the rats they could see than among the doctors they couldn't trust. The city's rat population reportedly grew unusually large during this period, feeding on discarded medical waste that may have included human remains. What makes Dr. Blackwood's crimes even chilling is how easily they occurred within the legitimate medical system. Victorian surgery was already brutal, with mortality rates often exceeding 50%. Surgeons took pride in blood-stained operating gowns and believed pus was part of natural healing. In this environment of accepted barbarianism, Blackwood's experiments weren't seen as dramatically different from standard practice. The case raises disturbing questions about medical authority and patient vulnerability that remain relevant today. How many other Dr. Blackwoods operated in shadow throughout medical history? How many experimental procedures were disguised as legitimate treatment? How many victims suffered in silence because society deemed them disposable? The archives of Victorian medicine are filled with similar horrors. Doctors who performed surgery without anesthesia to study pain responses. Physicians who deliberately infected patients with diseases to test experimental cures. And surgeons who used human subjects like laboratory animals. Dr. Blackwood's rat experiments represent something deeper than individual madness. They embody the dangerous intersection of scientific ambition, social prejudice, and unchecked authority that has plagued medicine throughout history. In our modern age of informed consent and medical oversight, it's tempting to believe such horrors couldn't happen again. But the fundamental conditions that enabled Dr. Blackwood's crimes, vulnerable populations, institutional secrecy, and the worship of medical authority still exist in various forms around the world. The victims of St. Bartholomew's Hospital deserved better than to become footnotes in medical history. Mary Kellerman should have lived to her 20th birthday. Thomas Gareth should have returned home to his family. 8-year-old Emma Hartwell should have grown up to have her own children. Instead, they became unwilling participants in one man's twisted vision of healing, their suffering justified by the false promise of scientific progress. Their stories remind us that behind every medical breakthrough lie countless human lives, and that the price of progress should never be measured in innocent blood. The next time you enter a hospital, remember the rats of St. Bartholomew's. Remember that medical ethics weren't born from philosophy, but from the screams of patients who trusted doctors who had forgotten their humanity. Some horrors are too important to forget, because forgetting guarantees they'll happen again. What haunts you more, the experiments themselves or the system that allowed them to continue? Share your thoughts below and make sure you're subscribed with notifications on, because next week we're diving into an asylum where doctors convinced patients they could cure madness by removing pieces of their souls.